Hello all. As people are entering the room, please be sure to select your language because Arabic translation is available. We'll wait 2 more minutes for people to come in. For those just joining, the chat will give you instructions on how to select your language if you would like this in Arabic. For those who've entered, welcome. We'll start in about a minute. Please select your language if you would like Arabic. Click the interpretation button. It's on the bottom of the screen. I think we have critical mass. Shall we get started? We've got an ambitious agenda. Hello, everybody. Good morning from New York. Good afternoon, wherever you are in the world. Good evening. For those just joining, if you want this in Arabic, please scroll to the bottom, click the interpretation button. Arabic is available as a language, so you can hear this event and participate in the language of your choice. So I welcome you to this discussion on gender and COVID-19 and the research agenda in the MENA, the Middle East and North Africa region. Why are we all here? Well, we're here to strengthen the regional discussion, to network, to provide space for knowledge sharing, to foster dialogue, to identify research priorities, to further collaboration for research that's going to lead to action. Because what we've seen in the last over 1 year in terms of COVID is its disproportionate impact on women and girls. And the MENA region is not immune to that. We know whenever there are crises or insecurities or pandemics, no different. The populations that are already vulnerable before the emergency hits are more vulnerable during. And there are effects that we could have anticipated, didn't pay attention to, and now have come acutely into view. And for the region as well, for the Middle East and North Africa, it already struggles with the worst social indicators, the widest gender gaps, the longest protracted crises, refugee and displaced populations, a range of emergencies and insecurities, and specific to the case for Lebanon, if you'll allow me, the ramifications of the Beirut blast, the economic crisis, government collapse, and repeated restructure, and continued layered insecurities that are impacting women and girls, on top of which COVID also sits. So you can imagine that this is a very timely and important discussion. And what you've got is a stellar lineup here of experts brought to you by the co-conveners, which is the Arab Institute for Women at the Lebanese American University. I myself am the executive director. My name is Lina Abirafa. I probably should have said that. Also Abhad, the Resource Center on Gender Equality, a very well-known organization based in Lebanon, and doing some pioneering work on gender-based violence and other issues. And our partners, the United Nations University International Institute for Global Health. We're delighted to be partnering with them again. So with these, I will perhaps introduce you to the Institute and then let others speak on their interventions and their work that they do, and let them introduce themselves and their efforts. So the Arab Institute for Women is a 48-year-old institute that works at the intersection of academia and activism. It is the first of its kind in the region. It is one of the first in the world. It covers a range of issues and thematic areas, focusing on education, research, development, outreach, youth engagement, advocacy for social change and policy change. It really is a pioneering institute, a hub, a bridge, a natural convener, a feminist fueling station, and an action point, a touchstone really for all of these issues, which is why we've taken on the challenge of understanding the gendered implications of the COVID-19 pandemic as one of our focus areas over the last 15 months. So that is the Institute, and you can learn more about us on our social media, etc. Same for Abad, same for UNU, Institute for Global Health. So I will, without further ado, remind you all, for those who have just joined, that Arabic interpretation is available. Scroll to the bottom. Please click the language of your choice so you can benefit from this discussion. We really want everybody to be a part of this. And there will also be time for questions at the end. So for now, let me introduce Michelle Remy, who is talking about the scientific community's response to the pandemic that has shown us how effective rapid mobilization and global coordination of a research agenda can be. And even before the pandemic, actually, research agendas have been developed for a range of topics and have played a role in focusing research efforts and galvanizing funding, which is critical. So Michelle's going to tell us about UN University's work and collaborations and partnerships. Tell us about the initiative with the University of the Western Cape, how you collaborate, crowdsource, how is it feminist, how are you deconstructing the narrative, and how are you taking the research agenda forward for gender and COVID-19? And you have 10 minutes to do so. Michelle, the floor is yours.
Thank you so much, Lina. Thank you. And it's really a pleasure to be here. And thank you very much to the co-organizers and to all of those of you who have joined us today. Yes, so the slides are up. So my name is Michelle Remy. I work at the United Nations University International Institute for Global Health, which is based in Malaysia. The United Nations University is a UN agency, and we function as a think tank for the UN system. So our particular institute focuses on global health, and I lead our research pillar with a strategic focus on gender and health. We also host the Gender and Health Hub, which is a platform for knowledge sharing, evidence generation, and engagement, really focused on the how of integrating gender in health policies, programs, and health systems. So for this initiative, we have partnered with the University of the Western Cape with Professor Asha George's leadership to respond as quickly as possible and as inclusively as possible to the immediate need for more attention to sex and gender considerations in the COVID-19 research and development efforts, as well as the broader research and response efforts. So since the start of the pandemic, we've seen that the interactions between sex, gender, and COVID-19 have been complex and have been evolving. On the one hand, we've seen, the direct impacts and effects of biological sex and socially constructed gender on differences in COVID-19 outcomes, with higher rates of severe disease and deaths among men overall. And the pandemic, but then on the other hand, the pandemic response has actually amplified existing gender inequalities, as Lena was saying, with women bearing the heaviest burden of the indirect health and socioeconomic consequences. And beyond this general picture, there's also a lot more nuance with context and intersecting factors influencing the devastating health impacts for different groups of women, men, and gender diverse people. So there were some very early calls and a lot of advocacy from activists, from researchers, policymakers that underscored the need to address and mitigate these deepening gender inequalities in this crisis response. But the real-time responses have been limited by the existing and widespread gender biases among decision makers, but also the weak evidence base and often incomplete data systems to actually track and understand what was going on. We also noticed that the sex-based differences and gender inequalities were insufficiently integrated in the research efforts. And this is the focus of our initiative, with some very real implications for the quality of the science and the effectiveness of the tools that are being developed to respond to this pandemic. So next slide. RNJ, please. Yes. So we came together with the University of Western Cape, and I cannot highlight this enough, with many experts, practitioners, passionate voices from around the world to jointly develop a shared and prioritized research agenda on gender and COVID-19, which addresses intersectionality and looks at the global health response, but also the intersectoral responses to COVID-19. We were very committed to ensuring that this was a truly global agenda and not one that was, that was really led by the Global South. And so we built in ways of ensuring, of representing those principles and trying to get as many voices in the conversation as possible. So we engaged with UN agencies, of course, and WHO's leadership in coordinating the overall COVID-19 R&D efforts, as well as the Gender and COVID-19 Working Group, which many of you may know, the Sexual Violence and Research Institute, who have also done a similar process for gender-based violence. We also had several open calls, webinars, and engagements in with different groups, and in this case with different regions, to really follow those principles of being feminist, but also decolonial in our approach. Next slide. It's coming. So here you can see the steps that we took. So we started this in August last year, and we started with some heavy sort of stakeholder engagement and outreach. We then jointly developed with participants who responded to the call. We jointly developed a protocol for the entire agenda setting process. We formed thematic groups, which I'll tell you a little bit about as well. And then developed a website, which was the platform for the real engagement and the real conversations to happen, which if someone can pop into the chat, the GHH Buzzboard. We launched those in the real conversations towards the end of December, early January. And through those conversations, we eventually came to identifying with inputs from many people from around the world, identifying what were the gaps, what were the key priority issues, and a list of research priorities and research questions that need to be taken forward and need answers to strengthen our response right now, and also to prepare us better for the next pandemic. We then went into a consolidation phase, which was really about distilling what was coming out from all these conversations and consolidating them into thematic reports. All of this is publicly available to everyone who's part of the Buzzboards, and that includes the long list of research priorities under each group. And we are now at the phase where we are prioritizing the research questions, and we really want to welcome all of you to be part of that prioritization phase as well, to make sure that the priorities that come out do reflect the needs and the realities in your region as well. The end point is the consensus building around this common shared agenda, which will be in July. And of course, the work doesn't stop there, because once we have the agenda, we then want to make sure it gets implemented. So this is where many others can play a part, of course, but this is where we hope we'll have something solid to move forward with. Can you move on to the next slide, please? And Lena, I'm trying to do less than 10 minutes actually, so let me see how I'm doing. In terms of the engagement, just want to highlight here, really, we were really very happy to see the response. We got a very enthusiastic response from around the world, and we were particularly pleased to see that it was dominant or predominantly from the global south. We tried very hard to engage further with the regions where we were not seeing as much engagement, but we still feel it's you know, it's good. It could be better, but we were really quite happy with the level of engagement we got to date. Next slide, please. So just to give you a sense of the types of the themes, I've mentioned the thematic groups, but we've had 5 themes around which the conversations have been organized. The first is around health, behavior, and status of those directly and indirectly affected by COVID. So this group looked at the sex and gender difference in the severe disease outcomes across different age groups and subpopulations with a gender lens. It's one of the areas that's come out very strongly is long COVID and sex and gender differences in that, the experience of long COVID and the indirect impacts on other health outcomes like mental health and NCDs obviously with a gender lens. The second group is on research and development for therapeutics and diagnostics. So this one was very, very focused on the sex-based differences in, for example, vaccine outcomes, adverse events, the need for sex disaggregated data and clinical trial analyses and the enforcement of these requirements by regulators. The third one is health service delivery. So this is focusing on the gender difference in access to quality COVID and non-COVID health services, the impacts of the pandemic on disruptions to other essential health services, for example, and what were the gender-related implications, impacts, but also what have been some of the innovations to maintain services. And how have those had gendered impacts. The fourth group is on the social determinants of health. There was quite a breadth of issues. Gender-based violence, of course, came out very strongly. Impacts on labor, income, unpaid care, the impact of on education and school closures, the differential impacts by gender, and also stigma and discrimination of various groups that have been exacerbated by the pandemic. And lastly, governance, which is the sort of the governance of the health system and beyond of the COVID-19 responses. And I'm getting a message that my time is running up. So next, so I did not do too well, but it is my almost final slide. This was just to quickly tell you about the next step. So I already mentioned where we are. We are at the prioritization phase, and we really invite you to be part of this next phase. And again, in terms of the really next steps in impact, we hope we can continue this conversations and engagement with many of you in the region to see where does this go after the research agenda. Next and final slide, I just want us, this is just to leave it there to say this is a big effort, and there have been an amazing group of people behind this from every region, I think nearly of the world, who have really led this process and provided their leadership to keep us moving forward. Thank you very much.
Thanks, Michelle. Fantastic. You did well on time. For those who are tuning in, please check out the chat. There's information on how to get involved so you can be a part of setting that research agenda. Look at the buzzboard, send an email, follow up, because actually this is a critical conversation and it's a chance for you to have your voice heard. Now, passing the mic on to Dr. Jennifer Skolterwes and Jana Mrad from the Lebanese American University. You all please introduce yourselves in detail, but you are going to be telling us about the wide-reaching impacts of the pandemic, the severe social determinants in terms of health, the gendered manifestations, and how this is different from other economic crises in terms of female employment, what has happened due to social distancing, the impact of lockdown, women losing their jobs, social safety nets that are compromised, women's lower earnings, savings. I don't want to preempt all of this, but you've done some incredible research through LAU, through the Arab Institute for Women, and you are going to share some insights with us on priority issues, needs, and gaps. Jennifer, Jannat, the floor is yours.
Thank you, Dr. Lena. Shall I share my screen or I don't know? Oh, I'll share mine.
Yes, please go ahead, Jannat.
All right. right, so can you see my screen?
Yes, we can. Thank you.
All right. So hello everyone, my name is Jana Murad and I'm currently the Gender Studies Research Specialist at the Arab Institute for Women. Today, Dr. Jennifer Schulte and I will be presenting a study that we conducted at the start of the lockdowns that were imposed by the government in Lebanon in order to combat the COVID-19 pandemic. And just so you know that when we collected the data, we had no goal in mind of how the output is going to look like. We just thought that it was very timely to collect data. And what we came up with is a paper and an article that we will be sharing the findings of today. So the purpose of the study was to assess the impact of the spring 2020 lockdown that was imposed by the Lebanese government in light of the COVID-19 pandemic and how that affected women in Lebanon when it comes to their professional and personal lives. The study was a collaboration between the Arab Institute for Women and the Title IX office at the Lebanese American University. The tool that we used was an online survey, and it was conducted in April 2020, and it was circulated on online media platforms such as Facebook, Instagram, and Twitter, as well as shared to AIW's contacts. 274 participants consented to participate in the survey. 221 of them were women who were residing in Lebanon, and that is the sample that our study focused on. So 70% of female respondents who resided in Lebanon were aged between 25 and 44 years. 6% were under 25 years old, and 24% were over 45 years old. 87% reported that they share their living space either with their family or others. And 63% of them reported that whenever they were working from home, the living room was an acceptable option. So the major findings from our study, we have three major findings. First of all, employed women are slim in Lebanon. So in our survey, over 85% of participants were employed. However, this does not reflect the reality in Lebanon, where only 29% of the female labor force were employed in 2019 compared to 70% of their male counterparts. So one of the shortcomings of our study was that our sample was overwhelmingly wealthier and better educated than the average female sample in Lebanon. The second finding is that women bear the unequal burden of unpaid care work. And that was reflected through a number of female respondents in our survey who emphasized that the increased workload, including housework, childcare, and caring for the sick or the elderly, and their professional jobs were exacerbated as a result, and special emphasis was put on women who had children with special needs. In addition, the lockdown disrupted the little balance that existed between women's personal lives and professional lives and added to their unpaid care burdens. And in Lebanon, women have been and will always remain a critical component of the family care system, and they are considered to be society's safety net in Lebanon. The third and last finding is that employers still expected the same results, even though employees were at home. So when it comes to productivity, when we asked respondents, they were almost equally divided between those who thought that their productivity remained unchanged and those whose productivity was affected. And in addition, those who said that their productivity was affected were equally split. 48% reported to be less productive and 52% reported to be more productive. However, 25% reported working an equal number of hours, and a slight majority, 51%, reported working more hours, and only 24% reported working fewer hours, which also reflects the lack of balance between professional and personal life. And respondents explained that they worked more hours because employers and even colleagues assumed that they are available at all times to answer their questions, even during holidays and on weekends. Challenges of working from home that were reported included the lack of a dedicated space for working, internet problems, connectivity problems, and the lack of a consistent electricity. In addition, 66% reported that they would continue to work from home if given the opportunity, while 33% preferred going back to their workplace. And the majority of respondents suggested that a hybrid or a smart working week is the ultimate model that should be followed in Lebanon, even after the pandemic. Now I'm going to leave the floor to Dr. Skulte, who will go into the conclusion and the further research needs.
Okay, thank you very much, Jana. So I assume people can see me? Yes, okay, great. I'm Dr. Jennifer Skulte with the Lebanese American University. And regarding our conclusions and future research needs, we've said that our sample was unlike in many ways the broad range of women's experience in Lebanon. But this we still found interesting because even among this very privileged group of women who have professional lives, were able to work from home, tend to be wealthier and more educated than other women in Lebanon, they still face tremendous challenges. And indeed, COVID presented significant challenges, but also a disintegrating state with what welfare net existed has largely deteriorated. Economic crises, financial crises, environmental crises, and traditional gender roles, both at work and at home. Still, these very privileged women were forced to do more with less. So you can imagine what other less privileged women are facing in Lebanon. Also, and we think, again, we wanted to try to gather data because something that is an ongoing challenge in Lebanon is just the lack of reliable data and access to data. The survey also didn't really ask enough about stress from the pandemic, political instability, economic crises, etc. And this, we think, is also a very important future area of research. And also, despite significant efforts to improve working from home policies, to maintain productivity, women will continue to be at a disadvantage unless their non-work lives, the unequal care burden is addressed. And this came up again in our research. Please, next slide, Jana. And then one of the most significant impacts of the lockdown in Lebanon, as well as worldwide, has been really not only the toll that is taken on women trying to juggle various things, but that they indeed have been pushed out of the labor force and that this may well continue. And as Jana noted at the beginning, women in Lebanon and in the entire region had the lowest participation rates in the formal workforce in the world. And this is also an area that we think bears more research. And finally, given the multiple crises that Lebanon is facing and the ongoing COVID crisis, there is some fear that people will say the only security is to push back into the traditional family structures and practices, push women out of the workforce into the home. And given all of these stressors, of course, the power of women to determine their own life trajectories is going to be limited. And so we really fear that even the somewhat marginal or small amounts of progress that have been made by women will come to an end. So this, we hope to, will have more research. Thank you very much.
Thank you both. That was fantastic. Really insightful research. Now let's take it one step further. Anthony from Abad, you've sent your link in the chat. Thank you so much. You all know better than most what the impact is of GBV. You know, obviously, globally, 1 in 3 women and girls are going to experience some form of violence in their lifetime. You all are dealing with this. at the grassroots level in a very acute way, providing a range of services and support, both on the prevention and response side. You guys have been working on collecting and analyzing data on the survivor experience. And I think that is what you're going to share with us today. Also noting that COVID has increased intimate partner violence globally in dramatic ways that we perhaps could have anticipated, but unfortunately, globally, we just weren't prepared for so much of this. So Anthony, you have 10 minutes. Please tell us about how things are going in terms of violence against women.
Sure. Thank you so much, Lena. It's great to be here with everyone, and thank you so much for the United Nations University and the Women's Institute that myself and Abad are always so proud to be affiliated with as a partner for creating this space. I will try to be less than 10 minutes. Perhaps I should start with when I first got introduced to feminism. A colleague of mine gave me The Second Sex by Simone de Beauvoir. And it really impacted me, the fact that women are peripheral to men and everything was male-centric, and it was really eye-opening. And I remember thinking that was definitely the case at the time of Simone de Beauvoir, and it still very much is the case today, but hoping that there was an element of progress that this would not be the case. And even though I don't think we should forget all the progress that has been made, I think you can really measure the impact of progress or the sustainability of a progress in times of crises. And I believe that the COVID-19 pandemic really did show how much women are still marginalized, are still neglected when we are thinking of the impacts of something as detrimental and as debilitating as COVID-19 is globally, and especially in places throughout the global south, like Lebanon, which has many developmental issues aside from COVID, where proper rights to protect women from violence in their own homes still don't exist, and patriarchy is still very much blatantly a status quo without the need to pretend that there are efforts being made politically and structurally to reach equality for women. And I believe that the global pandemic, like most things, the first thought was for everyone's health and isolation. And so measures were taken by the government as well as recommended by public health figures for everyone to stay inside their homes and not to full lockdown was instituted. And even though obviously this did need to be done to some extent or needed to be done for COVID, when we're really taking into consideration the well-being of all of our citizens and all of our people equally, not centrally some and some marginalized, we need to think of the ramifications of things that we try to institute on the general population. And I don't think that was really the case of thinking of how this lockdown and COVID-19 impacts GBV and impacts levels of domestic violence in the country. It was simply instituted. And if it wasn't for the work of amazing activists that I'm lucky enough to work with at Abad and other civil society actors in Lebanon, I think it still would be something that isn't spoken about, the dramatic increase that was witnessed in gender-based violence in the country. I just want to share, if possible, one document that shows this is the call logs to our call center, the number of calls that we receive each month to our call center from survivors of domestic violence, people willing to seek help, trying to access our shelters, trying to get information. And as we can see through the numbers beginning in January 2019, this was up until last quarter, only up until last March, you can see the dramatic increase in calls to our call center of women who are seeking help, women who are trying to get out of a violent situation that became exacerbated by lockdown measures. And I really, you know, I don't have any particular research to share, but I believe these numbers by themselves are quite daunting. And the fact that we're still witnessing quite high numbers as of March of this year, 376 calls to our call center of women who are still suffering and surviving and living with instances of domestic violence in their home. And again, who not enough efforts are being done, whether that is in bringing more attention to the situation with research, pressuring our government for whatever that is worth to do something about it, or even having the general population really understand the magnitude of this violence and the impact it'll have on generations to come in terms of normalizing domestic violence, normalizing the power differentials that still exist between men and women, and the lack of a legal structure and the rights of women to live lives free of violence in their own homes. So I look at this at near the beginning of the lockdown. We had a campaign called Lock Up, Not Lock Down. I have put that in the chat for anyone who would like to go see that on our YouTube page. And it was with this campaign that we really tried to have people reach out through social media, or even by hanging out laundry sheets with the number of the call center that women could reach. And we did that because, again, not knowing enough about what these women are facing within their own homes, living with a perpetrator of domestic violence in a lockdown situation. Very often they don't even have access to social media, or it's monitored very heavily by that person who was perpetrating. So this was one campaign that we did to get out knowledge about the call center, where women could reach, how they could reach us, and that would directly connect them to the internal security forces as well. I think I'll stop there because I think there's so much to hear from all of our wonderful speakers to share the research that we just heard from Ms. Murad and Dr. Sculte. But I would really like to thank and emphasize the importance of sessions like this and the importance of the hub that the United Nations University is starting, because it's so important to create more research, to bring more awareness, specifically about the situation of women as marginalized populations and women in all their intersections. Still not enough data exists about refugee populations, women living with different abilities, different class struggles, as a result of the COVID-19 pandemic. And I really believe this is the step forward. So thank you all for creating that space, because as the numbers show there, that it could not be more urgent than right now to focus on the situation of women living with domestic violence in Lebanon.
Thank you, Anthony, for highlighting that. Absolutely right. As somebody who's worked on gender-based violence for decades, there is no greater crime. And I look forward to questions and conversations later about how we can better and more effectively address this. Next in our lineup is Jamal Nasher and Anna Rita Ronzoni, who are talking about their experience working with WHO and telling us the extent of the pandemic's disruption of essential health services and its impact on women and girls. So things like antenatal and postnatal care, family planning, contraception, malnutrition, all of these kinds of health impacts that have been severely detrimental, and what you all are doing at the EMRO office and at WHO to play a normative and technical role in guiding and informing the COVID response. So please share with us your reflections on gender-related policy priorities, evidence gaps, and all of that from your expert perspective. You have 10 minutes. Thank you.
Thank you so much, Lina, and I'm very glad that I'm connecting with fellow colleagues on this important issue. And we in the East Mediterranean region, and maybe I clarify at the beginning, the East Mediterranean region for the WHO extends from Morocco in the west up to Afghanistan and Pakistan in the east. 22 countries are in this region, which are in North Africa and in the Middle East. And since the beginning of the pandemic, the East Mediterranean region has been working very closely with the member states and the governments and the ministries of health in the region to strengthen their capacities towards the COVID-19 pandemic response, and also to highlight issues which are of major importance. And one of them, and a major part of it, which is the interaction of COVID-19 with the gender issues. I would like to begin my intervention by saying that the pandemic has had a major impact on women and men, their health and well-being, and their socioeconomic implications. The effect and the individual experience has been variable based on the biological and gender characteristics, and also the interaction with the social determinants. And as we know, though men are more affected than women, they remain the women most vulnerable directly and indirectly to the pandemic. Over a year and more in the pandemic, there has been data limitations on the availability of sex and age disaggregated data. And that has been hampering analysis of the gender implications of the COVID-19 and eventually the development of appropriate responses. We all know, and there's evidence that an important aspect of the pandemic effect has been violence against women and children during the lockdowns. And another important area of concern was the effect of the pandemic on health services and the access to essential sexual and reproductive health and rights for women and health that have been greatly affected. On the area of health workforce, and we know that most of the women constitute a large share of the health workforce, and they have been facing increased risks and vulnerability during the pandemic. In 2021, our available data, the global data, shows that health is delivered by women and it's led by men. Women account for 70% of the health workforce, and it's mostly concentrated in the areas of nursing and midwifery professions, with far fewer who are physicians or leading the health systems. And while the women representation in the health sector has been increasing over time, particularly among the higher wage healthcare occupations, still the gender gap is in the division of labor. The situation of the East Mediterranean region in the countries is similar to the global trend, where 35% of the women versus 65% of the men hold physician positions. And while for the nursing profession, around 80% are female versus 21 males. Also, the effect of the pandemic also has been the access and information and prevention and care and financial and social protection that women and girls are the most vulnerable. In addition, there has been increased stigma and discrimination that has also occurred and has been hampering the effective response. So by me describing this situation, WHO has been advocating for a major focus on gender in the COVID-19 response, and the emphasis on the most vulnerable, the women and girls. In addition, it has been calling for more investments in the gender-sensitive research on health and socioeconomic impact of the pandemic. As part of the technical guidelines and guidance that we've been given member states, we've been calling for 7 areas of work, and these could be also priority areas for research and more information gathering and analysis. The first is to better report and data analysis of disaggregated data based on sex and age. In addition, inclusiveness of responses to violence against women, and my fellow colleague Anarita will be shedding more light about this, this important issue. The third area is to maintain availability and access to essential sexual and reproductive health during the pandemic. And also in relation on reference to health workers is to ensure that frontline health and social workers and caregivers are given equitable access to training and protective material during the pandemic. And here we speak specifically about the needs of women who constitute the majority of such health workers. Also, we are an advocate that the health sector should include more women participation and include gender transformative policies that are needed to address inequities and eliminate gender-based discrimination. And at the same time also, removal of financial and other barriers to COVID testing and treatment services. And at the end also to stress that health is a human right and to ensure that emergency response to COVID are inclusive and non-discriminatory in addition to measures to identify and counter stigma and discriminatory practices in COVID-19 response. I give the floor to my fellow colleague, Anna-Rita.
Thank you so much, Jamal, and good afternoon, good morning, everyone. It's really a pleasure to be with you today. Thank you for the panelists, and allow me to thank especially Anthony for bringing on this table Simone de Beauvoir. I really want to recognize this, and really we should bring the feminist legacy. We should be grateful for this and bring this vision forward. Saying that, I will try to complement Jamal's speech and with some consideration related to gender-based violence and the health sector. During the COVID-19, gender-based violence has been called the shadow pandemic. And as Lina was mentioned, it was already before this pandemic a very high percentage of women subjected to violence, and it is dramatically increased, as also Anthony showed us during the pandemic. And reports from women organizations such as Abad in other also countries of our region highlighted an increase between 40 up to 70% and maybe more of call and requests for help. From a health point of view, at the WHO Regional Office for the Eastern Mediterranean, we have been trying to understand whether this pandemic also brought more requests of provision of healthcare for GBV survivors, and together the health cluster in 3 countries, Afghanistan, Somalia. Rabbit survey showed that health services GBV survivors in need of healthcare. Somalia, for example, even for female genital mutilation. Nevertheless, this increase in survivors' requests for help was coupled with major gaps and real challenges in ensuring the continuation of the essential services that survivors are in need of. And I think that this COVID-19 pandemic showed to a wider audience what was already clear to gender and gender-based violence experts and activists. One, that gender-based violence tends to increase during emergencies, including health emergencies, and that if health systems are not prepared to address gender-based violence, its impact can be devastating. We can definitely say that COVID-19 and gender-based violence are interrelated pandemics. And it's very important for us working in the health sector to keep these elements, which are usually and unfortunately designed as gender neutral processes. However, as we saw, the same gender factors that are at the base of gender-based violence increase living healthcare and pose health security issues. I think we are running out of time, so I will try to be very quick. I have many things to say, but I will try. So WHO, as Jamal was saying, tried since day one of the pandemic to really play a key role in addressing COVID-19 and gender from a health perspective. We have many initiatives that are currently ongoing at APAND at the regional and country level. Just to highlight some example, in Afghanistan, we work with UN Women, with our colleague from UN Women, to draft a guidance note for Afghanistan Women's Protection Centers operating during COVID-19. In Iraq, along with training health providers, we have been working with the frontline workers from Ministry of Interiors and Ministry of Defense. We're the only one allowed going around during lockdowns. And in Pakistan, we have building a GBV specialized telemedicine support. Let me just conclude with 4 priority messages that I really would like to share with this group. That what this year and a half of the pandemic taught us is that health systems have a core role and stake in preventing violence from happening and in responding to survivors. So what it is very clear is that gender-based violence and health services should remain open with sufficient staffing and funding to provide life-saving services. It's very important we keep in mind that gender-based violence are life-saving services, gender-based violence services, and keep training health providers on how to provide gender-sensitive health care for survivors. And definitely from a research point of view, investing on data collection and research, even in time of health emergencies such as the current COVID-19 pandemics. Thank you all.
Thank you both. Fantastic interventions, really rich in terms of the research. I look forward to the conversation. Finally, one more speaker in our stellar lineup from UN Women, Manal Bankiran. Thank you so much for joining us. We're delighted to have you. You all have played a critical role in keeping gender equality on the agenda. Obviously, that is your mandate, but also during the COVID pandemic, as part of the response, you've conducted cross-country research so we can better understand the gendered impacts of this pandemic. And I think you're here with us today to share some findings from that research and help us identify priority issues, needs, and evidence gaps. Manal, the floor is yours.
Thank you very much, Lina. I'm going to time myself because the last speaker is not always the one that gets most time, but I'm really delighted to be here and I'm really happy to participate and contribute to this discussion. And I'm also impressed with all the work that has been done by other colleagues. So in March 2020, I mean, we were all concerned, and you mentioned that UN Women was also concerned not only by the pandemic, but by placing gender equality at the center of the discussions, because measures were taken by different governments to curb the spread of the virus, and we were not really conscious at the time of the consequences it may have. And that's why UN Women Regional Office identified some critical areas as priority areas that need to be taken into consideration. And this includes most of the themes that were addressed by the panelists. Gender-based violence was one of them, unemployment, economic and livelihood impacts of the pandemic on women. The unequal distribution of care and domestic work was also one priority area that we identified. The fact that the voices of women and girls were not included in the response and decisions that are taken at the various platforms, and also the need for evidence and to incorporate gender analysis in the decision-making processes. And since it was an unprecedented situation in the region, we were very curious and we wanted to capture what was happening in the region as it relates to these different thematic areas. And we, for this reason, we conducted two big assessments to explore and see what is happening in the region in terms of violence against women, the economic impact of the pandemic, particularly on women and girls, and also the changes within social roles inside the households. And for this, the first study that we conducted was a multi-country study that we conducted in 9 countries. These were Morocco, Tunisia, Libya, Palestine, Iraq, Jordan, Lebanon, Palestine, and Egypt, which are countries where we have UN Women offices in the region. And we also conducted a survey among civil society organizations, and because we wanted to capture also the voices of civil society organizations who were at the forefront of the pandemic, and we managed to get insights from over 220 organizations from 14 countries in the region. So the first survey that I mentioned had over 16,400 participants from these 9 countries. And as was mentioned by my colleagues earlier on the Lebanon study, it was very difficult to find a way to reach out in a random manner to participants in the region. So we collaborated with a private sector company that allowed us to access random internet users in those 9 countries and offer the possibility for them to participate in the survey. And we took into considerations the completed surveys across the region. But this was an innovative way for us to collect data in the times of the lockdown. And with civil society organizations, it was more an online survey that we circulated to our networks through the different offices where UN Women is operating in the region. And today, I mean, thinking of the insights and thinking of all the results that we got from the surveys, I thought that I might be sharing with you or structure the insights around 3 points. One, sharing the negative results, I would say, or those that confirmed our concerns on gender equality issues in the region. And then share with you also 3 promising results that would require an investment to ensure sustainability of these positive points. And conclude with the 3 areas that would require further research to better understand the needs in the region. So starting with the bad news or the findings that actually confirmed that women were the ones who are bearing the consequences of the pandemic. And in most of them, they did not come as a surprise. One was very much aligned with the results that we had from Lebanon. It's about the fact that women have seen the time devoted to unpaid care and domestic work increase. And although there were some indications that both men and women were doing more domestic work, women were the ones who are having the lion's share. And what was particularly interesting is that the survey responses confirmed that women were almost exclusively tasked with chores like cleaning, cooking, and serving meals in particular. So despite the fact that some men were involved in some activities inside the household, those activities were exclusively done by women. Knowing that we are in a region where women bear more than 4.7 times the burden of unpaid care work, and in some countries it's even more, this means that the increase added more burden on women during the pandemic. And we had also this confirmed through the fact that some women, like more women in the region, use the telecommuting option more than men. So this is also something that is adding more to women than men. And that's why it's very important to continue the efforts in the region and introducing this rights-based approach to defining and studying more unpaid care work and focus on the unfair distribution of unpaid care work and the burden it sets up on individuals, particularly women. And that's why there is a need to work more to eliminate this discriminatory distribution of unpaid work, to allow access to opportunities, including economic, political, and public life, including in crisis times that similar to COVID. So that's the first point. The second point was, as confirmed also by the previous speakers and shown by the statistics shared by Anthony, is that violence against women was a serious threat to women in the region during, but also beyond the pandemic. And because the results that we got, we were not, obviously for ethical considerations, we were not able to ask direct questions about experiences of domestic violence. So we asked indirect questions about whether the participants or respondents witnessed or knew a woman who was subjected to violence, and we asked about the type of violence that they've witnessed. And we asked also questions about feeling of safety inside the household, and women who said reported feeling unsafe. There were at least 1 in 5 of them expressed their fear of domestic violence. But what was concerning in those findings is that the acceptance of violence remains high. So the results of the assessment showed that nearly 1 in 3 respondents, both men and women, said that it's okay for women to accept and tolerate violence, to keep the family together, including in times of a pandemic like COVID. And this acceptance of violence is what will continue and perpetuate violence beyond the pandemic. So violence was not new to the region. It has been there before the pandemic. It was exacerbated during COVID, but it will continue as long as we do not address the thoughts and attitudes that we have, and this acceptance that is widely spread. So this is another negative finding that we need to keep in our minds and address when responding to violence in the region. What was also interesting through the study that we conducted with civil society organizations is that many mentioned that their work has been negatively impacted by the COVID-19 pandemic, and many said that they would not be able to remain operational if adequate funding is not made available. And that's why keeping in mind that the services are delivered to women survivors, many services are delivered through NGOs. It's very important also for us to know and better understand the needs of civil society organizations and see how to better support them and continue to build their capacities, especially in using digital platforms to reach out to women and continue providing the services. Now on the promising results of the study. The first one was the increased time devoted by men to unpaid care work. I mean, this came as a very interesting finding. And across the 9 countries, men acknowledged having dedicated more time to unpaid care work, particularly time dedicated to teaching children and taking care of the elderly. I mean, this was also confirmed by women respondents because there were at least 2/3 of married women in all surveyed countries that agreed also that their husbands were more involved with domestic tasks and with care of the family during the lockdown. And that's why we thought that these are promising results that need to be sustained beyond the crisis and explored further to understand how we can build on that. Another interesting and promising finding was the fact that violence against women was recognized as a real threat by the community, by the respondents in the region, and considered as a need for prioritizing it even during the pandemic time. Particularly among vulnerable groups such as women migrants, refugees, women living with disability. And this reflects indeed a high community awareness on the issue. And it could be explained by the exposure to media articles and programs and awareness raising campaigns that took place also in most of the countries surveyed. Because there were a lot of debates about the shadow pandemic, and a lot of young people through the survey also expressed their willingness to engage in activities to prevent and respond to violence. And this is one of the promising results. I think continuing or exploring ways on how to use young people and engage them more in the response, particularly young men, is also very important. One very interesting finding that came through the survey, and it was consistent across the 9 countries, was that when asked whether the woman that the respondents knew sought help, of course, the reporting of the violence incident was very low. I mean, not reaching 40% in some of the countries, but definitely lower than that in many of them. But when a woman decided to seek help, the first door they would knock at was the police. And this came also as a surprising point because we thought that they could turn to NGOs or family and friends, but actually they turned to the police. And this was consistent across the 9 countries. And that's why we thought that it would be very important to work very closely with the police if they are the first entry point and work to make the police response more gender sensitive. So that's another thing. Now, just to conclude with the 3 areas that could be researched further.
30 seconds for those 3 areas.
Definitely, I'll do that. So we need to explore the services that women are interested on more because there were a lot of responses checking other. So there were some services that were mentioned by civil society organizations that were used during the pandemic, like traditional mediation, traditional courts. So it's worth exploring further this. The second one is about the emergence of other forms of violence, not just domestic violence, like online violence. And this is something that we're currently exploring also at UNU regional office. And also the use of digital platforms in delivering services to women. This is something also that we need to explore further. Yeah, I'm like 2 minutes beyond the time. Thank you very much.
Thank you. There's a lot to say, and there are a ton of resources in the chat. I encourage you all to please check them out, follow up, and really do a deeper dive into all of this very valuable information. We are not at the post-pandemic stage yet. We are still in the thick of it, and we don't know how this is going to evolve. So there is a lot of learning that we still need to do. So now, opening up to questions, please raise your little Zoom hand. And I'm going to try and see you. I strongly recommend that you take advantage of this stellar panel because it is an incredible miracle to have everybody all together on this Zoom call, and I would love for them to benefit and for you all to be able to ask all of the questions that need answers. So please, I'm waiting for the chat to explode. Let's have a conversation about how we are going to do this better, what we might have learned from this, at least in the preliminary stages. And let's hope we never have to do it again. But it strikes me as somebody who has worked on women's rights for, well, close to 3 decades, that we continue to not learn the lessons that we say we have learned. So let's hope that this time we actually get things right. And there are so many of you who are here, so there's an obvious interest. I'm waiting for a question. Oh, Anthony, is that you with a hand? You're asking a question?
No, that was me applauding what you said about learning the things we've learned.
Oh, that's applause. See, I just discovered the hand last week. Anyway, so that was applause. Look at that. Okay, are there any? I see no hands up, but let me actually tell you all. I'll tell you one thing that I saw living in New York now as a result of this experience that I thought was absolutely fascinating. I don't know if anyone else is here in the city, but what I noticed is at the onset of the pandemic, so March 2020, feels like 100 years ago, we in the city were asked to subscribe to a chat, a text service to get messages and to receive the latest updates. And so from March until about May, we got 3 to 5 messages a day, and they were very consistent. And they were, stay home, stay safe, stay home, stay safe. And I thought, well, this is not going to go well for everybody, but let's just see how this plays out. And in May, so almost 2 months into the pandemic, somebody else must have gotten hold of the messaging because it changed. And the texts we received were, well, home might not be safe for everyone. And if that's the case for you, don't worry, call this number, take this action, do this, X and Y. And I thought, all right, that's unfortunate because we lost 2 months of time that we could have anticipated, could have predicted, we could have known that this was going to happen, because we know that although home should be safe for everybody, it actually isn't. I think that is an unbelievable thing that we still have to contend with in this day and age, but it's true. And we could have anticipated it and we didn't. And the result is that we say we are listening to women, but we are not. And even here in the city with the simple act of text messaging service, we failed to listen to women from the onset to see what the impact might be of a message that assumes that home is safe. That clearly is not the case, because intimate partner violence is the most common, is the best hidden, and still shrouded in shame and blame everywhere in the world. Oh, is that a hand? No, it's not a hand. Goodness, you guys are all stunned into silence. There are 50 people participating, and I'm going to run them on a log until somebody, oh, here we go. Okay, as we move globally to vaccinate as many people as possible. Oh, I'm so glad we have a vaccine question, actually. What are the gender barriers that we need to pay attention to? Actually, I would love somebody to answer this, because there has been some conversation about if decision-making around vaccinations are, if that is gendered or not. So let's start. Oh, now we've got questions. Oh, there you are, everybody. So happy. Good morning. So the first question about the vaccine and gender barriers. Who from our lovely panel wants to take that? I'll ask the other questions and we'll see. I think we can also have a conversation in the chat, and I would actually encourage all of you participants who are clearly experts in your own right and already working on this issue to type up answers if you have any, because again, this is a conversation, and as hard as it might be to run it remotely via Zoom, let's take advantage of the fact that we are all together, and there would be no other situation where we could all be physically in the same space. So the next question, so the first question is vaccines and the gendered implications and barriers. The second question is, besides safety from violence, did any of the services provide other support like IT or food provisions? So maybe something around basic needs and other services and support, I assume provided to women. And the other question is, what have been successful ways of reaching policymakers in the region on gender and COVID issues? Any success stories there? So 4 questions. Oh, here's another one. What else could and should have been done, including but not limited to messaging program, etc., when looking at lockdown measures? What's in the works for next time? Oh gosh, I hope there's no next time. Both from programming and policy perspectives. So, panelists?
We have 2 hands raised. So there's Anthony, followed by Anna.
Wonderful. I am going to get on mute so you guys can do the talking. Take it over.
Yeah, I will be happy to answer to the question about the vaccine, but I will leave to Anthony first if you want to go first.
Thank you so much, Anna Rita. Please go. That was the first question, so maybe it takes precedence.
All right, just give me 1 second. Put my headphone on. Sorry. All right, so that you can hear me better. No, actually, I mean, like there was a very interesting discussion around of course, the COVID vaccine and gender-based violence implication. We had a webinar last February with the gender-based area of responsibility. And I just would like to take one sentence that I say during my intervention is that sometimes public health, or most of the time, unfortunately, public health intervention are thought as gender, I wouldn't say gender blind, gender neutral processes, no? We think that, I mean, it's something that is applicable to everybody. And vaccine is the same, whether it's the COVID-19 vaccine or other vaccination or other immunization campaign. So, I mean, it is really important to consider the risk factors and the barriers that can prevent certain population to access to something that it's like a health right for everybody, right? And specifically for the COVID-19 vaccine, but also taking from others' experience, I mean, we should consider restrictions, for example, imposed by family member to women to access the vaccine. The traveling distance for women could be a barrier to access the vaccine. In our region, as this webinar is focusing on our region, how are the facility designed taking into consideration gender-related sensitiveness, confidentiality, which is something that may prevent actually women and girls to access the vaccine, and without talking about the risk of sexual exploitation and abuse. And also because Jamal mentioned the health workforce, there are also possible exposure of female workforce to some violence and burden, double burden, pressure from the workplace and pressure from home. So, I mean, I think it's very important from us, for us working in the health sector, we take this consideration while we are doing the planning, if it's not too late, for the vaccine, as I think we will have to deal with this COVID vaccine for a long time. So let's just start taking this consideration into account. Thank you.
Anthony, do you want to follow up? Thank you,
Yes,
Anna.
sure. No, that's wonderful, because I did not know how to answer the vaccine question. I wanted to hear that answer too. So thank you so much, Anna Rita. Maybe I could just come in. There was a question about what else was provided for women in terms of, I believe the question was more about kits or things. So nothing exists in a vacuum. And sadly, this past few years in Lebanon has been extremely challenging, with an unprecedented pandemic, along with an unprecedented financial crisis, political corruption, which has existed, but national protests against that government, and of course, the blast in Beirut that took place in August. And again, coming back to the centrality of patriarchy that disables responses to be effective for women. Many products were made available at a lower cost by the government. So the government, provided a few products that would be at a lower price for the Lebanese people, essential need products. Among them were razors for shaving, because the people who are making these decisions were men, but none of feminine hygiene products, no products that have to do with the period or anything that affects women's health was included in that list. And so our organization did try to use different funds that were available to us. Also, because of the global pandemic, we had to shift a lot of the money that we did have that were primarily for doing activities on the ground that now were being done online. And that's actually how we were able to do that, to try to respond to these needs of women. We provided food stipends. We provided, again, these kits that were handed out, especially among refugee populations living in Lebanon, to try to compensate for the lack of accessibility of a lot of these products for women. And aside from that, there was one question about what else could be done. I mean, that's a conversation that takes way too long. And I would like to be ironic here in saying that I attempt in my life to be optimistically critical. And I think that we heard from a lot of the research positive points as well as very troubling points. One that stood out to me, because my passion is in masculinities and my work is in masculinities, is how much there is an increase in men taking on domestic chores, how much there's a sharing of burden at home. And as much as that does bring warmth to my heart, and it is something that needs applauding, and it is something that really brings me joy from within, I also am reminded constantly of a history where every time there's been an exceptional circumstance, whether that be war or pandemic or financial crisis, we see how malleable these rigid binary gender roles really are. And almost every war in history has seen women go into the workforce and sustain nations and continents because of the growth that they have, only to be reduced back to the normal status quo of patriarchy when things resume to normalcy. So one thing that I think could be done differently is to try to think ahead from now, not only to respond to the needs that we have, but to try to see if there are these growths, if we are noticing trends where gender roles are shifting and changing, how do we sustain these things? How do we not throw out the baby with the bathwater? How do we work on what still needs to be done and try to harness the changes that we did see while continually trying to promote growth? And I think that in itself is quite a big goal to have for the future.
Thank you, Anthony. I think that's great. Actually, I would love for the narrative to change and for the perception of who does what, roles and responsibilities. I mean, what would really warm my heart is if we even stopped using language like men helping women with the dishes or helping women with childcare, when those are in fact their dishes and their children. So I think we really need to work very hard to understand that everybody is born with the same abilities to take on responsibility for all domestic things. There's nothing magical about my hands that makes them expert at washing dishes. So I think we have some ways to go. There is some progress. Let's hope for the silver lining. I see a question about ways of reaching policymakers in the MENA region. Does anybody have an answer to that? But let me also say, good luck with that. Policymakers are all old men.
Lina, I was trying to raise my hand, but I think I was made co-host, so there is no way. So I'm just jumping in the conversation exactly to answer this question. And I just want to shed the light on some good practices actually that happened in the region that were quite surprising from policymakers. If you recall, around, I think it was in April last year, where the Secretary General made a call, calling on people to reduce violence inside homes. And also there were a lot of reports that came from the United Nations around the need to consider gender in the response, particularly in the economic empowerment area. And as a follow-up to that call, there were countries from the region that took the lead and mobilized others in the region to respond better to the shadow pandemic. and some of the countries that committed from our region to do this. And some good examples can be shared and listed, like governments that invested in some applications that are government funded to be able to connect women to services despite the pandemic or despite the lockdown. There were examples of countries that issued decrees to consider services provided to women survivors as essential services even during the lockdown, to allow women or social workers or care providers to go out and provide services to women. So these were some good examples. Also, there was a possibility in some countries, and Lebanon was one of them, Morocco was one of them, to file complaints online, so that, like, to a court or to police officers, and these were also some good examples. So there was a response to this call from the Secretary General, and some of the measures that were taken by the countries to fund and respond to violence against women during the pandemic could be found in the gender tracker, COVID-19 gender response tracker, which was developed by UN Women and UNDP, and I can share with you the link. It lists all the measures that were taken by the countries. It's being updated regularly, but it captures also what was done by policymakers. And one last thing, which was an initiative that was led by Egypt, Saudi Arabia, and Algeria from the region, was the issuance of a resolution, of a UN resolution around the acceleration of efforts to address COVID and gender issues in the world, but like particularly in the Middle East. So I think there were some good initiatives. They just need to be sustained and continued, because the pandemic is still here, but there are also bigger challenges that we're dealing with in the region. And I'll put the link for the gender tracker in the chat. Thank you, Lena.
Fantastic. Thanks, Manal. There's two questions. I think we've got a couple of minutes left. One is about the so-called creep of remote work that expands into non-traditional working hours. Is that going to continue over the long term? Well, my guess would be yes, but I would love to hear Jennifer and Jenna's perspective on that. And then the fact that women are becoming the de facto tutors, et cetera, for children's education, and remote schooling has really added an extra job for women. And then the next question, let me jump to that, is about the police. The police in helping women seek appropriate pathways. So maybe that's a GBD Anthony question, or anyone who wants to answer.
Okay, it's a great question, I think, and our research, I think, demonstrated two things. On the one hand, for our sample of women, they, over 2/3 of them would like to continue with some sort of remote work. They view the flexibility as helpful for being both professional and then taking care of their personal lives. They seem to be willing, or feel that they're forced, to be very flexible in order to keep that flexibility. So it's really a kind of a double-edged sword there. But I would say that the creep, in the larger sense, the creep of remote work into having to be on all the time, 24/7, really ends up reinforcing this patriarchal societal structure where workers have to be on all the time. That's their full-time job, that's their identity. And in order to enable that, you need a full-time worker at home who is not involved in that capitalist system. So that, of course, doesn't necessarily mean that women are pushed out of the workforce and out of decision-making, but it makes it all the more likely unless women adopt more roles to be kind of de facto men. You know, and final point on that, employers from our research are mixed about remote work. But one thing that is clear kind of across the board in the global north, in the global south, is that there remains a bias against remote work, that somehow remote workers are not as productive, they're not as committed to their work, to their employer. And so given that women in general are already at a disadvantage in the paid labor force, adding that layer of them being more interested in remote work could really disadvantage them further. So I think overall, it's quite negative. So I'll leave it there.
Thanks, Jennifer. A question on the police. Anthony, did you want to say that
Sure.
really quick?
Yeah,
Okay.
sure. I can jump in. I'm sure that if anyone would like more information, please reach out to us because we don't have a lot of time. But here maybe I could highlight the importance of not waiting for something to go horribly wrong to begin this type of work. Abad for a few years now has been coordinating with the internal security forces, doing trainings with their staff, talking about the proper ways on which a file is started, how to address women when there is a call, sensitivities, how difficult that is for women to make that call in the first place, and so how that response needs to be done. And so there was a lot of coordination with the ISF. The number that actually we were getting out to people during our lock up, not lock down campaign that I talked about earlier was a direct line to the internal security forces. So essentially the women were seeking help both from Abad as an organization as well as the police in terms of responding to the domestic violence. However, of course, this is a relationship, especially in a patriarchal society, that needs a lot of time. And so even though there are very nice or optimistic or colorful signs for where this could go, this is where we follow up with the need for resources, the need for continuing this work so that we continually notice a progression in this sense. And just to say that that's a response to one type of violence, but there's also sexual harassment that still happens on the street. One thing that has become more of an issue that is completely under-researched in our region, although I know a couple of wonderful organizations working on it, is online harassment of women and sexual harassment of women. This is something that naturally was noticing an increase during the COVID pandemic, since most people resigned to online forms of socializing. So there are great signs in that relationship and how the police respond, but there's still so much more needed to work on in the future.
Thank you so much. Does anybody from the panel have any last words, like a 30-second thing before I close us up? Distinguished members of this panel, with all of your wisdom. Oh, we have a last question. Okay, in Lebanon, it's not just COVID. Oh, Lord, that's true. Yes, the economic crisis also exacerbates intimate partner violence. People can't access their bank accounts. Yes, the explosion, no government, no jobs. Yes. Okay, I think, so here is the question. I think our situation in Lebanon is worse than other countries. What do the panelists think? I mean, if I can use my moderator privilege and say, you know, I don't believe necessarily in the comparison, and I don't think that it is constructive, but does Lebanon deal with layered crises that are beyond what is normal? Absolutely. Beyond what any country can take? Absolutely. But panelists, do you have thoughts on that in particular? Last words, Lebanon. We say the hardest for last.
I can answer the question.
Someone from Lebanon, perfect. Thanks, Rana.
So basically, when all news media outlets are talking about how the situation in Lebanon is not, I can't even find the word. It just it escapes our imagination to just think that Lebanon is going through this right now. And when the World Bank comes and says that we are just we are now living in the third worst crisis that the world has faced since the 1850s, then that just means that everything that's happening is even worse than COVID. So you have COVID, you have inflation, you have a financial crisis, an economic crisis, political deadlock. People cannot take their money out of the bank. People are dropping out of schools. You have brain drain. The most brilliant people are leaving the country. And I think that women are going to be more impacted in this crisis than ever. So, and we can see that a lot of women, because they are based in the services sector in Lebanon and because they are part of the informal sector, they are bearing the greatest burden. They are getting paid really low wages in Lebanese pounds, which is basically worth nothing right now. And they have to take care not just of their kids and of their family, they also have to work. So I wanted to add something to what Dr. Skulti said, that because of COVID and and because of the lockdown, the definition of home or house, if you want, as we know it, has been changed. So our houses are not just a place for us to rest and to zone out of the world. Our houses are our schools, our workspaces, our gyms, our hangout places with our friends. So the situation in Lebanon is very difficult, and I think that we need more than 10 years to get out of this crisis. And I think that the only solution to our crisis lies in the political realm. So unless a government is formed, we are not going to be facing a better situation. I'm sorry, I was negative.
No, you're absolutely right. There is in the region, a disproportionate collection of very challenging contexts. Lebanon certainly is one of them. Palestine, what is happening, obviously Yemen, a dramatically underfunded humanitarian crisis. I mean, this region really is bearing the brunt of all of the world's messes right now. And I think I will use, oh, Anthony, you have 30 seconds and we're closing.
30 seconds. Thank you, Jenna. That was so wonderfully said. And just to add on that, all of the things that we're going through in Lebanon are correlates of domestic violence and violence against women. But we can't forget that the root cause of violence against women is patriarchy and patriarchal thinking and patriarchal gender norms. So even though they exist and we can work on them, the root causes are still the things that lead men to feel entitled to use violence against women and society to use violence against women. So we don't have to wait for the situation to get better to work on that. Although the situation does look grim, as Jenna so eloquently put it. Sorry for that, just needed to add that in.
No, that's absolutely right. And I love that we've brought it back to really the root cause. Thank you, Anthony, because at the end of the day, you know, talking about which country is worse is not going to get us to what we need, which is to get all these countries better. And this is a long-term job. And I think we all should be in this for the long haul and prepare for what is a very challenging fight. One that has been going on well before my time and will continue probably forever. In any case, let's hope for some minor improvements over the coming years. Let me summarize what we've heard today in about 1 minute. The UNU talked about facilitating a feminist understanding, mapping and gender COVID research, leading to consensus building. I encourage you all to be a part of that. The Arab Institute for Women and LAU talked about how COVID is a threat to an already precarious economic situation for women based on research. They talked about women doing more with less, which I think is our kind of life story, and questioning the power of women to determine their own life trajectories. I think that we need to think through that lens for just about everything we do, pandemic or not. Abad, you talked about gender-based violence. Intimate partner violence is the most common. Why can't women be safe in their own homes at any time? I do not understand. Lock up, not lock down. Absolutely, yes. WHO, you talked about health delivered by women and determined by men. I think that's absolutely right. You identified priority areas that can be used to determine a research agenda. I think that's perfect. The shadow pandemic, GBV, it is for me the pandemic. It always has been. We just have never paid enough attention to it. A reminder that gender-based violence is life-saving, absolutely. I think this is the crux of it for everything. The violence that women endure in every place and space at every time, whether pandemic or not, war or not, insecurity or not. And how things are ironically gender neutral in a world that has never been gender neutral also is one of the mysteries for me. UN Women, you also talked about GDP, economic impact, restricted livelihoods, the unequal share of care, the domestic burden that has expanded, the voices of women not included. Again, we are a broken record when we talk about these kinds of things, and the research that you all are doing, all of this put together, all of you experts with your passion and power and persuasive voices, thank you so much. I think you have so much to say. You have highlighted all of the challenges, and I hope you have galvanized the participants and certainly me in terms of the way forward. I look forward to more of it. Please keep fighting. We have a long way to go. This is one conversation of about 1 million that we need to have. I really appreciate you. Thank you, everyone. Thank you for hanging on.
Thank you.
I think that's it.
Thank you so much.
Thank you all. Thank you.
You're wonderful as always, Lena.
Thank you, everyone.
Thank
So
you.
you inspire me. Fight on. Much love from New York.
Thank you.
Bye.
Bye-bye. People still linger.
Thank you again, Lena, for the amazing moderation and really inspiring insights.
Awesome. I'm glad that worked. We ran a little over, but it's okay. 3 minutes is fine. We started 3 minutes late.
Yeah, that's
all right.
All
Michelle,
right.
you all good? Where's my friend Michelle?
I think she's gone off, but I will ask her to follow up over email also.
No need. As long as everyone's happy, that's great. Really good. Lots to talk about. Lots of enthusiasm. Thank you. And I'm going to have some breakfast.
Yes, please do that. All right. Bye-bye. Thank you.
Bye, everyone. Thank you.